Hello everyone, my name is Dr. Aditya Kumar and I am a public health professional. And today is World Mental Health Day. And on this day, I am going to discuss with you guys about schizophrenia. What is schizophrenia? What are the symptoms, diagnostic and treatment modalities? So, schizophrenia can be defined as a chronic or severe psychiatric condition in which a person experiences delusions, hallucination, disorganized speech, etc. What are the symptoms? Symptoms of schizophrenia can be divided into positive and negative symptoms. Positive symptoms include hallucination, disorganized speech, delusions. Guys, hallucination is usually, in most cases, related to auditory hallucination. So, what happens in auditory hallucination? There is like conspiracy going on in their mind in second and third person. They are talking about the patient. They are hearing voices that someone is doing conspiracy about them, or someone is implanting a chip inside of their head to listen their thoughts. So, these are kind of things that a person of schizophrenia experiences. It can be negative symptoms as well, which is affective flattening, in which a person is unable to express the emotions properly. Anhedonia, in which there is lack of excitement in previously pleasurable activities. It can be evolution. It can be alogia. So, guys, how can we diagnose schizophrenia? Schizophrenia, as you already know, schizophrenic patient is already not self-aware and they are not in that kind of mental space to know about the symptoms that they are experiencing. So, how do we diagnose or identify if a person is having schizophrenia? It is usually by interviewing the person who is close to them. How do we determine that the person we are interviewing has observed symptoms and is in a condition to know whether they can identify the symptoms present in the patient? So it can be identified by 5 C's. Number one, coherence. The things they are talking about, it makes sense. Second, chronological order. They are talking about things in a chronologically. When it started, where it started, how it happened. Third, closeness with the patient. If the person you are interviewing is close with patient. So, what are the treatment modalities? Treatment modalities include antipsychotics. Antipsychotic in medication part, cognitive behavioral therapy. So, what are the medication that are being used? It usually consists of antipsychotics. Guys, I want to ask you one question. Do you know what is the first psychiatric drug that was introduced in the market and in which year? Yes, guys, you guessed it right. It is chlorpromazine, which was introduced in early 1950s. And the second one, as you all know, is imipramine, which was introduced in market in late 1950s. So we will talk about antipsychotics. There is first generation antipsychotics, second generation antipsychotics. Usually these drugs are associated with some side effects. which are extra pyramidal side effect, metabolic side effect, sedatory side effects, and it consists of drug like olanzapine, clozapine, etc. So guys, I hope I was able to communicate with you guys some important information, and I hope you understood every bit of thing from this video, and I hope you spread this information to everyone. And please guys, like, share and subscribe to Public Health Collectives. Thank you.